our channel, Sammy Medical. Hopefully you're one of the 10 people following us on YouTube.
10, yeah.
We're really going viral, people. And we think this is part 6 of our 10-part pregnancy journey.
Yeah.
So if you've missed our videos, we're essentially taking you through when you're thinking about having a baby, and then when you want to start trying, and the different trimesters, of which there are 3. I'm very clever like that. And I'm Christabel. I am one of the GPs, Christabel Sammy. I own a practice called Sammy Medical Practice in Rockingham, Perth. And this is?
Narafia. So I work here every Tuesdays, and I'm also a midwife in private practice. So
she's an amazing midwife. That's why I keep her around, because I look really clever next to her. Well, actually, that could be a little bit rude, but I don't mean it in a rude way. I don't mean that she's dumb and I look clever. I mean that, like, I look cleverer because she's so... I'm going to stop this train of thought.
Christopher, 10 minutes. We've got 10 minutes.
Yeah, we're really bad at short videos, and this might be why, because we sometimes natter. So part 6 of this 10-part series, please help us out and give us a like and subscribe to our channel.
Yes,
as always, we are not trying to be your midwives or doctors, and we're giving you general advice, so please make sure you consult with your own doctor to make sure it's applicable to you and your family.
Yeah.
And so today we are kicking off with... This is what you guys have all been waiting for. This is like the bit of the movie that you don't want to miss with the popcorn. Labour.
The exciting bit.
The baby's coming out.
That's right.
The watermelon?
The watermelon
is coming out.
Oh, God.
So, guys, I'm going to do you a favour. I'm going to ask you all those silly questions that you feel a little bit nervous asking. I'm really good at asking the silly questions. I'm not even acting. And hopefully it's informative.
Yeah.
So... Narafia, kick us off.
Yeah.
This pumpkin's coming out.
This pumpkin is watermelon is coming out. Watermelon pumpkin. So you by now you'll have regular contractions. Yeah, they're coming on strong, might be coming on fast, or they could just be like nice and spaced out, like 2 in 10 minutes or something like that. Yeah. So in labour, it's important that you stay nice and active. Yep.
Got to keep things moving.
Got to keep things moving. So, and it also will help with pain relief. So when I say active, so it's like moving, you're moving loads. You know, if you're wanting to rest, you kind of, rest like, head on a pillow, leaning over a ball like that.
Because this is all the stuff that isn't in the movies. This is the stuff that's at home before you even get to your birthplace or the hospital. Yeah. So this is all the stuff, like in the movies, you just sneeze and the baby pops out. Dude, this is the hours before. The hours before.
Exactly.
What about, what's it called? That Rebosia scarf.
The Rebozo.
Oh, there we go. I got it right. Have you guys seen this? Yeah. Google it. Yeah. We'll pop a link maybe on our Facebook about it. Tell us about it.
And I think we actually did a demonstration of that.
We did. Right? Probably our most successful video was our nurse Cheryl actually being the patient, or the pregnant lady, and Narafia
demonstrated. Yeah, it's a scarf. So it was so the Rebozo itself is the name of the scarf, and it originated from Mexico, basically. That the Mexican midwives and the Guatemalan midwives used it in labour, and they use it to actually help reposition a baby that maybe is not quite fitting right.
Because
for comfort measures.
I have to ask, and I apologise, this is a silly question, so you ladies out there, might even be too silly for you to ask. What happens if the baby's not like in the right position, like if they're posterior or because the baby needs to come out the right way. Yeah, exactly. Well, the babies spin, so there's a really cool website called spinningbabies.com, and you can like Google that and just like look at it in more detail. But basically, the baby's not a static passenger, right? So with the contractions and with mum's moving, how she moves actually enables her pelvis to kind of open up and shift position, etc. So then the babies also navigate. So birth canal. So you could use the scarf.
So with the scarf, exactly. One, helps to give them a nice uterine massage, helps to align the uterus. There's also other techniques so with the posterior. So most women out there, you'll know the posterior presentation is when the babies are back to back with the mum. Yeah. So it doesn't mean the babies can't turn. It just means that you might have a longer labour and you might feel a lot of it in your back. So with the spinning babies technique and the use of the Rebozo scarf, you can use this really nice technique called shake the apples.
Oh yes, we talked about that in our video. So you have to watch the video.
You gotta basically you're putting the scarf over the woman's bum. She's at a particular angle, and then you just like shake the bum basically.
Yeah, to move baby.
To help to move.
Because essentially anything that's going to shorten this labour. Because if not, you are going to use this against the kid for the rest of their lives.
That's right.
At their 18th birthday, you'll say, "Yep, because I was in labour for 25 hours.
And that is quite a common thing, okay? So don't be scared of the numbers of the hours, because you probably won't realise it at the time that you've been in labour for hours.
Time flies when you're having
fun.
fun.
Exactly.
I could think of other ways to have fun, but hey ho, each to their own.
Speaking of
Yes.
other ways to have fun,
Mm.
right? So it's important, if you think about the conditions that you need or the environment that you need to bring
Oh,
a baby
yes.
out,
A calm.
the same conditions that you were in to create a baby. So nice dim light, a bit of
Let's talk
mood
about
music. That's it.
sex.
Because that will help the hormones of labour and birth to just flow, and then things will progress a lot quicker, and just that you're better able to deal with the intensity of the contractions in labour.
Exactly. So you want to have your birth plan,
Yep.
which you think about painkillers and stuff, but you also want to think about your birth environment.
Yeah,
So
exactly.
think about who you want. You know, if mother-in-law wants to come, but you really don't want mother-in-law there,
Yep.
just have that difficult conversation now.
Absolutely.
You want calm people, and
Yes.
sometimes that's not always your partner.
No.
Sometimes
if it's
it
no
can
good,
be.
if
Yeah,
it's no good, you're better off.
You've
just-
got what
just
you
save
need
your
now.
breath. Yeah, that's
I'm a
right.
bit mean, aren't I? But no, you need to. No, like it's a myth. You don't have
Absolutely.
to have your partner in there.
Yeah,
They
absolutely.
sometimes don't want to be in there, and they're
Yes.
just doing it because you want them to.
Yeah,
So let them go out, because they might not be very calm if they're going to
that's
not
right.
be that
Or
personality.
faint,
Yeah, you might want your mum. You might want just a completely different support person.
Yes,
you
you-
might
you
want your
could-
mother-in-law.
Yeah, so you could hire a doula.
Yes,
Yeah, doula is a great labour support. So
Yeah.
it should be, an important part of your birth team. They call it your birth team.
Yeah.
Because it's not just a physical support, but it's emotional support
Yeah.
as well. And if your partner is going to be there with you, and if you don't have a doula, you can get the partners to learn like massage techniques.
Yeah, so that's why we actually say, because a lot of people say as a partner, they say to me, Chris, what am I going to be doing there? Like, what's my role?
Yeah.
And essentially your role is not to piss the lady off.
Yeah.
That's the big one. Whatever
Keep
you
it
do.
smiling, keep
Yeah.
it relaxed,
Smile.
love, give it love.
But actually, if you guys do an antenatal class, which
Yeah.
I'm a big fan, I really get women and couples to
Yes.
do an antenatal class. That's when your partner can learn some tips of
Yeah.
massage and tricks and how they can support you.
Yeah, absolutely.
But yeah, make sure you have a good environment,
Mhm.
and you don't always have to have your partner in there.
Yeah, because you need to feel safe,
Yeah.
and supported.
Mm.
Okay, because any little thing, whether it be a person or things that are being done to you, or the fact that you don't feel comfortable in the environment, is just going to interfere.
But it's also like, those fire walkers and stuff, the people that just walk across like hot fire, and you think, dude, that's gotta hurt. They don't feel the pain because their mind's in the right place.
Yeah.
So this is a marathon,
Yes.
and you need to get your mind right, and
Yes.
that needs to be training for it properly.
Yeah.
I'm marking my example.
You
I know the
are.
Rafi's looking at me like, we didn't rehearse this.
Exactly.
Oh my god, it is a marathon, and
It
you
is a
need to
marathon.
train for it. You need to make your body right for it,
Yes.
and you need to make sure that along the road
Yes.
you are well supported.
Absolutely. Yeah.
And at the finish line, the partner can be there, and you can give them the baby and say, "Now you take over, dude."
That's right. Yeah.
So firewalkers. Think of firewalkers.
Yeah.
I think that's really it
Oh,
from before labour, right?
Yeah, and if you're giving
What is
birth in the hospital, you've got other pain relief options as well. So at home, you might be using the shower.
Yeah.
If you've got a nice big deep bathtub, just get in there.
Now, can I ask a stupid question? I'm going to do the
Yeah.
stupid question. Why does everyone talk about water and showers and baths? What's the water doing?
It's a warm. One, it's a warm.
Okay,
Yeah.
yeah,
So
cool.
So if you imagine like a muscle that's working really hard,
Yeah,
and then when you get a strain, what you want to do? You just want to put a nice
yeah,
heat pack
you
on
have a
there.
hot bath.
Yeah. So hot bath or hot shower. The bath, when you get in, so a lot of women opt to have a water bath.
Mhm.
So the water is very supportive,
Mm.
and then because the water is maintained at a particular temperature, usually around 37 degrees, it's like well, I love baths. So you can imagine like you're like having this,
And all your
contractions,
muscles
get
be nice and relaxed.
Absolutely,
Yeah.
and then you kind of feel like you're cocooned as well, yeah. And it helps with the tissues as well, like stretching your perineum when you get towards the end.
Yeah, and they're safe, aren't they? Water
Absolutely.
births. The baby doesn't
Yeah,
not
there
like
is some
coming
really
out
good-
water.
Yeah, no, there is some really good research because if you
Good.
think about it, the baby is in a warm water environment, right? Coming out into a warm water environment.
Yeah.
So why?
So it's actually just mimicking what the baby's
the
already
internal-
used to.
Exactly.
Yeah,
exactly.
I just asked this question because I'm sure a lot of ladies know this, but I think a lot of partners sometimes are a bit like, a water birth? What? Really?
Yeah.
So I'm just asking those questions.
And I know people get worried because, like, you know, when the baby comes out, I think, oh, what if the baby breathes water?
Yeah,
It won't, because that's not our initial instinct.
Yeah.
Yeah. So unless the environment, if the baby's like stimulated underwater, or until you get that change in the difference in the atmosphere, the babies won't necessarily take in, like, draw in a breath underwater.
Yeah,
anyway.
Perfect. And you're going to have a support person there to maybe out.
Yeah.
It could be like a big
I love
moment.
water birds. I love water
Oh,
birds.
it could be like the Lion King. La 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 la. My God, I'm not going to be a singer anytime soon. Thank God, I've only got this
Stick
thing.
to being a doctor, Christabel. Stick to being a doctor.
So you guys have to subscribe to our channel so I can even do that, all right? All about you helping me out. So yeah, ooh, my watch is going
All right.
cray. So if you're in the hospital, there's some painkillers.
Painkillers, yes. So
if you're-
water bath.
Yeah.
The
Some
gas-
hospitals have water.
Yeah,
gas.
some hospitals have water,
Yeah.
a big bathtub, but you can also still use the gas, the Internox,
Yeah.
if you're in the water.
And then there's things like epidurals and stuff.
Epidurals.
So maybe next video,
Yeah.
part 7 actually, because we're going to focus a bit on
Yeah.
that, we could just break down, if you are going to have a medical delivery,
Yep.
some of the things that will be offered to you in your hospital birth planning, and we'll just tell you some of the pros and cons about that.
Yeah.
So that's video 7
Yes.
from
oh my God, we're getting towards the end.
we're getting towards the end of the next series, yet to be decided or agreed upon.
Yeah, that's right.
So guys, please help us out. We hope you find these videos informative. If you've got any questions for the next few videos, definitely drop us a line and we'll answer them, because we'll like to know that somebody's watching them, so we definitely will answer it. And in the unlikely event we have too many questions, we'll just add another part to our series.
Exactly. Well, looking forward to that.
So signing out, this is part 6 from Sami Medical.
Yep.
It's Christabel and Arafia.
Arafia.
Have a lovely evening.
See
Bye-bye.
ya.